the mainstay of treatment for weight management or obesity is diet and lifestyle change. This will be heavily emphasized during your visits to GNL surgical. If the weight management will also include surgical procedures. Okay, surgical procedures will be the last resort to help people reduce their calorie intake and to lose weight. After extensive advice on diet and lifestyle changes and a cooling off period where you go and try these methods that have been advised, if all else fails or the body mass index fits the criteria, then you qualify for the last stage. The last stage will be surgical management of obesity. Surgical management will include endoscopic surgery and laparoscopic surgery. Endoscopic surgery will include a gastroscope, which goes in and looks at your esophagus and stomach, and subsequently will insert a balloon into the stomach and inflate it. This balloon will be kept there between 6 to 7 months and eventually removed, also with an endoscopy or a gastroscopy. During these 7 months, there will be regular follow-ups and there will be regular advice on the diet that you require and also lifestyle changes that you can adopt. The average weight loss for the balloon procedure is usually about 12 to 15% of your weight during these 7 months. The second part of obesity surgery would be the actual surgery itself, which is usually done laparoscopically or via keyhole surgery. There are 3 main procedures that are done in Singapore. The first one will be a laparoscopic gastric banding, where we place a band at the upper half of the stomach. The second one will be a laparoscopic sleeve gastrectomy, where the stomach is reduced in size with the use of staplers. And the last one would be a gastric bypass, which is also done laparoscopically, where the upper part of the stomach is connected to a lower part of the intestines, and the stomach in between and the intestines in between are all bypassed. The commonest procedures that we do now would be the laparoscopic sleeve gastrectomy. It is a keyhole surgery which uses only 5 small incisions on your tummy to reduce the size of the stomach. How this is done is the stomach has been stapled off somewhere at the midpoint of the stomach longitudinally, and the excess stomach will be removed. That leaves a thin long tube which looks like a sleeve. Therefore, the name, laparoscopic sleeve gastrectomy. The old procedure that we used to do very often would have been the laparoscopic gastric banding, where we put a band on the upper part of the stomach that is connected to a pot that we can inflate with water. The water goes into the pot and fills up the balloon in the band and makes the opening tighter and tighter, and therefore reducing the amount of food you can eat and slowing down the amount of food that actually goes down. As you can realize, all these procedures are actually diet restrictive. We are restricting the amount of food that you can eat with a smaller volume of stomach. We rarely do the gastric banding anymore due to the fact that there is a foreign body in the stomach. The last procedure is called the Roux-en-Y gastric bypass, done laparoscopically. It's a complicated procedure mainly for metabolic syndrome, which includes type 2 diabetes, hypertension and high